Congressman Self, welcome back to the program here. The Trump administration announcing just now that it's going to eliminate another 10,000 jobs, this time from Health and Human Services. Well, we've watched this happen across the federal government. And as a member of Congress who preaches fiscal responsibility, my question is, are Republicans still going to need to raise the debt limit here in the next few months with all these massive cuts happening in D.C.?
Oh yeah, the debt limit runs out in either August, probably August, and yes, we will have to raise the debt limit, and it's part of the reconciliation bill that we're discussing. In fact, I was meeting with a group of senators last night, and we believe we're reaching agreement on that. It will be included in the budget reconciliation bill.
But aren't these savings substantial that
Oh
Elon
no.
Musk?
Oh no, we'll still need to borrow money, even if
Sure.
we cut money out of the budget. No, those are two separate issues, because we will still be needing to roll over debt as well. So the debt limit is what we must borrow to keep the government going until we get to a flat budget, and we're not going to balance the budget anytime soon, Jason. We're simply trying to make cuts to cut down on the yearly deficit. So right now, I get a text every day. The last 365 days, it's been about 1.6 trillion, which is actually less than it's been for most of this year. But that's what we need to work on, is cutting the deficit with these cuts. But the debt, we'll continue to grow the debt until the deficit goes to zero.
Congressman, let's talk about these 10,000 job cuts at Health and Human Services. The timing for this state seems quite unusual, with a state like Texas trying to fight this outbreak of measles and contain that. Are you concerned at all about public health, public safety with so many job cuts?
No, because the job cuts are not going to be on the front line. I will tell you, we were just in the VA. We had a meeting with the VA secretary just a couple of days ago, and it's the same thing in VA. We've got layer upon layer of bureaucracy and regulation. Now, I haven't talked to the HHS secretary, but in the VA secretary, and he's got the largest healthcare organization in the government. They have found that there's layer upon layer of organization and supervision. So no, I'm not concerned at all, because we're finding so much bloat in the federal government. So, and frankly, the secretaries will then correct what they need to of these cuts, because we're also finding that if someone is inadvertently cut when they should not have been, the secretaries are going back and making those corrections. So we're working on the bloat in the federal government.
Social Security also in the news. I was looking at some of the numbers from the Social Security Administration. 150,000 people in your district in Collin and Hunt counties receive some type of benefits from Social Security. Do you support any cuts at all to SSA?
Look, no person who receives benefits currently will ever receive a cut unless Congress does nothing. And then probably about 2034, all of us, every person on Social Security, will take a 20% haircut. Some people say a 22% haircut loss. So Congress must do something in this issue. Now, it's not going to happen now because, frankly, in reconciliation, we cannot do anything to Social Security because by law, we can't under reconciliation. So no, and I need to make sure that people understand that current beneficiaries, until the trust fund runs out in 8 years or so, 7 years, nothing will happen. Congress has got to do something, though, eventually about Social Security. We've got to shore it up for our kids, for our grandkids. If we want Social Security to be there in the future, we've got to do something.
But cutting people who work there are, Social Security Administration already has a terrible reputation about call wait times. I've heard complaints about verification, people getting verified for Social Security benefits. Are you concerned that cutting that bureaucracy is going to impact people who receive benefits?
Well, hopefully they will be cutting the people who represent the bloat in the federal government. And every office has got it, I can tell you from what we're finding. Every office has it. So no, and again, back to the secretaries, the confirmed secretaries that we now have in place.
Sure.
If someone is cut that should not have been, or it's an unintended consequence, the secretaries are going back and making the corrections. So in individual offices, individual workers and employees, they're making corrections on the fly as they need to.
I want to ask you about tariffs here, 25% tariffs on cars and car parts that are made outside the country. I'm hearing, you likely are too, congressmen, from mayors, from CEOs from all over the state here, who say that they're concerned these tariffs could negatively impact their communities. What are you telling these mayors, these CEOs, these people who are shopping for a car right now?
Well, frankly, we're still in the negotiation stage. President Trump is using the tariffs as a negotiating tool at every level. And I suspect that is the case here because much of the commerce that goes across the Texas-Mexico border are car parts.
Sure.
So we in Texas have a vested interest in making sure that those car parts in the short term continue to move. In the long term, though, obviously, President Trump would like to see that manufacturing come back to the United States. So there's both a short-term impact and a long-term goal under President Trump, and we'll see how it shakes out. But I suspect that the tariffs will work because they're working because many countries, a very small part of the U.S. GDP comes from foreign countries in any individual example. For a foreign country, much of their GDP comes from the United States, and that's why tariffs work over the long term.
But the short-term impact is painful to folks who live in your district, live in North Texas.
The president's been very clear that until he gets through the negotiation stage and everything shakes out and the countries reach an equilibrium, there may be a short-term impact. So the president's actually said that himself, I believe, and certainly his cabinet members have. So yes, there may be, but let's let it shake out because the goal is to make sure that we have a level playing field, and secondarily, the manufacturing comes back to the United States so we get the high-paying jobs here in the United States.
Yeah. Congressman, you've gone to great lengths over the last few days. I've seen on television and the DC Examiner to defend the Trump administration, the officials from using the Signal app to discuss sensitive military information. My question, though, I don't know if you've been asked specifically, but do you think that the National Security Advisor, Mike Waltz, should keep his job?
Yeah, this was a glitch. Look, I've been in those conversations. I've been in the White House Situation Room. I've been in the old executive office building in SC meetings when I was in the black programs in the Pentagon. I've had those discussions. I've seen them, and they get fairly frank. They get fairly brutal. And frankly, I think this was, we probably ought to take Signal off of the agenda. But if you note, he said early in that chat that you will get all of the details, all of the classified details on the high side. That means a U.S. government classified system. So yes, it was a glitch in the system that this man was in this chat. But no, this does not rise to to taking a job. And frankly, when you look at it, who were the people that they attacked? Who was the person that they attacked first under Trump 1? It was the National Security Advisor. Who's the person they're attacking first in this Trump 2? It's the National Security Advisor. You kind of have to wonder why that is.
Well, I mean, in fairness, the National Security Advisor added a reporter to that chat. Nevertheless, that's, he brought that up on himself, I would argue. But let me make sure I understand what you just said.
Mm-hmm.
You said that you think that maybe we ought to take Signal off the agenda. Do you think that high-level government officials should stop using this app for sensitive conversations?
Well, the White House has said they're doing the investigation. So I'm going to wait. And frankly, the senators have asked for that report once it's done. So let's let the White House do their investigation.
Sure.
They'll send it to the Congress and we'll take a look at it. But frankly, I don't think Congress is going to have to act in this at all because I think the White House is going to make the decision whether or not they want their folks to continue to use it, regardless of the level.
As a veteran with extensive military service, do you think it's a good idea for high-level military officials and government officials to use this app when discussing sensitive information?
Well, I was at that level of discussion before there was an internet, before all of these are available. So I only use truly classified systems. And yes, I think it's always preferable to use the classified system. And I think that's going to be the outcome of this. They will now use classified systems. But as we get distracted with all of this, remember, this was an extremely successful operation, right. And they had this discussion, as they always ought to, before we send Americans overseas to go kill people. We want to make sure that every impact, every aspect of it is discussed and rediscussed so that we make the best possible decision before we send young Americans overseas in harm's way.
Congressman, you have a bill that would, we've talked about before, that would ban people on SNAP benefits, food stamps, from actually buying sugary sodas. It's gaining momentum from a number of members of Congress, but we've seen similar legislation from this back in 2004, 11, 13, 15, and 19. Why do you think that your bill right now might be able to get across the finish line?
Well, because it's time. We now realize this is an idea whose time has come, frankly, Jason. We now know that sugary drink soda is the most purchased item under SNAP. And that SNAP stands for Supplemental Nutrition Assistance Program. And we want to continue to provide nutrition to those people who are on SNAP, our low income, no income folks. But the problem with it is not only that it's the most purchased and it provides no nutrition, it also subsidizes diabetes, heart attack, and obesity. So then we turn around and we pay for treatment for all of those conditions under Medicaid for the same people that we're subsidizing obesity, heart attack, and hypertension. So that's probably what people are realizing. If we're going to be healthy, if we want our less fortunate people to be healthy, we need to get them nutrition. And just to remind you, this is not one of the cuts that we're talking about earlier. This is a making sure that the money is well spent, that they're getting nutrition, that they're getting vegetables, they're getting meat, they're getting milk, which are the nutrition assistance program that we have in place. So that's what my bill does. It simply makes sure that the money is well spent for nutrition.
Congressman, before I let you go here, I want to ask you about your raucous town meetings that you've had in the district over the past few weeks. Do you plan any more of those?
The next one we're going to do is a telephone town hall because we want to kind of let this settle down a little bit. We want to make sure that we're talking to my constituents and not people that are coming in from outside of my district. So we're working through that because I do want to continue to communicate with my constituents. My coffees with Keith have been significantly, phenomenally successful over the years. And I want to continue to do them because I like retail politics. I want to talk to my constituents. But if there's no information flow in a meeting, then we need to figure out some way to get that information flow back and forth between my constituents.
Congressman, good to see you again. Thanks for the time.
Thank you, Justin.